So I'm here with Dr. Sozer. I'm very excited to spend a year with him. Specifically, I want to talk about a technique that he actually just got published in the newest PRS journal regarding his gliding brow lift.
I learned about hemostatic net almost 12 years ago in Brazil. I was the first one in the United States to use the hemostatic net 12 years ago. At that time, everybody thought I was crazy. Then Fausto Viterbo, who's a good friend of mine, came with the idea of the gliding brow lift, which is a technique done through tiny incisions and no skin is removed. The brow is glided upwards and secured with surgical net. And I started using that technique. And with some patients, I had great results, but with some patients, it did not work because their hairline was low. The skin that I had to work with was so limited. The surface area was so small. The gliding brow technique failed. Then I started thinking, how can I make it work with these patients? And I came up with the idea of extended gliding brow.
No, that's very good. So what are the main steps of this procedure? And how is it different from the standard?
The standards, usually there's a tiny incision and then you inject a tumescent solution to make the skin tight. Then you use dissectors, which are blunt, and separate the skin from the muscle. And then the skin is pinched like this with the sutures and elevates the brow. Basically, skin is being redraped. But if the hairline is low, there is so little area, it will fail. How could I increase the surface area? What we have is hair-bearing scalp. I decided to include hair-bearing scalp into this procedure, but you cannot do a subcutaneous dissection in the hair-bearing scalp because you're gonna kill all the hair follicles and patient will become bald. You go to a deeper plane under the hair-bearing scalp and subcutaneous superficial dissection plane in the forehead and the temporal area. And then I developed a unique way of joining those two planes together. Then we would drape the skin and give the excess skin in the hair, which would be kind of a little fold down there, but it's hidden. And over time, meaning in a few weeks, that little fold will disappear.
And actually seen you do it a couple of times now, and it works really well through draping the whole skin. It's really neat. Recovery-wise, is it any different? You
No.
do just same as
No, but
brow.
the space in the hair-bearing scalp is closed with bigger sutures, but because they're in the hair, so you can keep them for a longer period of time. Surgical net in this area needs to be removed in 3 days because it will leave marks. But the other sutures we place here can stay. Nowadays, we're keeping it for 10 days.
Last question. So for someone who's just starting off like myself, trying this new technique, any tips, any ways that you think that I should start?
I think in your case, it's going to be pretty easy. You'll be doing it a couple times a week with me.
Yeah.
If you've never seen it, this article has a pretty nice video. It's pretty straightforward. And just watching that video, they should be able to do the procedure.
Awesome. Well, thank you for walking us through your procedure. And I really encourage you guys to read this article. It's a great article and great videos.